Thank you, Chair. Honorable Your Excellency Ministers, Honorable Board Members, distinguished guests, ladies and gentlemen, good afternoon. Let me just first start by saying I'm greatly delighted and honored to join you today for the annual 21st International Inter-Ministerial Conference on South-Southern Triangular Cooperation in Population and Development. This year's conference is building on the theme on accelerating the move toward ICPD at 30. First and foremost, I would like to extend my profound appreciation to the government of the Republic of Bangladesh for their gracious hosting of this significant event. I would like to express our sincere gratitude to the PPD Secretariat for their commendable efforts in organizing this conference. Additionally, I must acknowledge the invaluable support extended to us by the United Nations Population Fund, UNFPA. For your collaboration has been instrumental in bringing us together, and we are truly thankful for your contributions to the PPD program of action, the PPD. Excellencies, distinguished guests, ladies and gentlemen, as we gather here today, we do so in momentous year on the cusp of the 30th anniversary of the adoption of the program of action of the International Conference on Population and Development, ICPD, and the impending 30th anniversary of the founding of the PPD in 2024. These milestones are symbolic of our enduring commitment to addressing population issues and advancing global development. Our conference takes place amidst a world population that has reached a significant milestone with a staggering 8 billion people inhabiting our planet. It is a world grappling with multiple crises, including the ongoing conflicts and the pressing issues of climate change. These challenges underscore the urgency of our mission and highlight the imperative need for innovative solutions through international cooperations. Excellencies, distinguished guests, ladies and gentlemen, the overarching theme of this conference, ICPD, demographic change, and the SDGs serve as a clarion call for us to assess the progress made in implementing this ICPD plan of action, the SDG goals and commitments. We must meticulously review the gains achieved and the gaps that persist and chart our future strategies and priority actions to bring the unfinished ICPD agenda to fruition. It is crucial to emphasize that the South-South Triangular Cooperation stands as a potent accelerator for the full, effective, and expedited realization of the ICPD program of action and the 2030 Agenda for Sustainable Development Goals. Distinguished guests, ladies and gentlemen, remarkable progress has been made in the past decades in the context of the ICPD and SDGs 2030 Agenda. The population growth rate in Kenya has declined over the years from 3.3% in 1984 to 2.3% in 2019 census. Again, in Kenya, the total fertility rate has declined over the year from 7 children per woman in 1984 to 3.4 children per woman in 2019. And is projected to decline further to around 3 children per woman in 2027. The life expectancy, just like many other African countries, our birth rate has significantly increased to 67 years in 2019 from 61 years in 2000, with the dependency ratio reduced from 86.6% in 2009 to around 75% in 2019. Equally significant is in the increase in the use of modern methods of family planning among the currently married women in Kenya, which has risen from 18% in 1989 to impressive 57% in 2022, and our target by 2030 is to have a CPR of around 64%. Kenya has been among the first countries that have developed the Demographic Dividend Effort Index, which is a robust tool that will help programs implementers and policymakers assess the local interventions and high-impact programs. Distinguished guests, ladies and gentlemen, in the previous International Inter-Ministerial Conference, South-South Triangular Cooperation, we recognize internationally as a key accelerators for achievement of the unfinished agenda of the ICPD and SDGs, including the Nairobi Summit outcomes. The government of Kenya has been fostering, promoting South-South cooperation by providing enabling environment for greater participations and implementations of policies and programs for achievement of ICPD and SDGs. In over the last 5 years, through the South-South cooperation, Kenya, with support of UNFPA, have provided technical support to a number of African countries in the field of population policy formulation, population census taking, and preparation of various population monographs arising from the population census data, knowledge sharing of demographic dividend modeling, experiences and approaches for galvanizing policy and programs actions in population and development and reproductive health. On the other hand, Kenya, like any other PPD member state, has benefited from provision of technical assistance, bilateral exchange visits, and cooperations, study tours, capacity building, beneficiaries of scholarships, documentation of best practices, sharing knowledge and experiences in improving reproductive and family planning services in humanitarian and conflict situations, and harnessing the demographic dividend, among others. Excellencies, distinguished ladies and gentlemen, Kenya recommitted to advance the goal of the ICPD Program of Action at the Nairobi Summit on ICPD. The National Council for Population and Development was tasked with the crucial responsibility of tracking and monitoring the implementation of the ICPD Nairobi Summit commitments and reporting on the progress of this commitment at the national level. I'm proud to highlight some of the remarkable achievements of the Kenya government in implementing the Nairobi ICPD commitments. First, after we had that summit in 2019, as the country that hosted with Denmark and UNFPA, Kenya formed a national task force of wider range of partners across various government ministries and non-governmental departments to report annually on the implementation of the country commitments. The progress reports are launched annually and strongly promote the South-South cooperation as accelerator in achieving ICPD and SDGs. A national integrated monitoring and evaluation online system was also developed to integrate ICPD indicators in all government programs to tackle the issues of triple threat, what we call ending teenage pregnancy, new adolescent and HIV infection, and harmful cultural practices. We have adopted a multi-pronged approach in eradicating female genital mutilation, gender-based violence, teenage pregnancy, and also ending HIV among adolescents. This is what we call in Kenya the triple threat. This includes strengthening coordination and multi-sector collaborations, intensifying education and awareness campaign, and targeting community gatekeepers at all levels to end these three major issues, which is HIV, teenage pregnancy, and gender-based violence among our adolescents and youth. Equally, Kenya has taken decisive steps to end female genital mutilation by strengthening coordination in areas such as legislation and policy frameworks for communication, advocacy, and evidence generation. In addressing gender-based violence, we are committed to ensuring universal access to quality reproductive health services, including prevention and management of GPV, even in humanitarian and fragile contexts. Looking forward, our government is committed to enhancing the integration of population health and development programs into what we call the Kenya medium-term plans and the medium-term plan expenditure framework. This approach will ensure that budgetary allocations are aligned with the efficient implementation of programs and projects, both at the national and the sub-national level, which we call in Kenya the counties. The fourth generation, what I was saying about the MTP4, policies, programs, and projects are aligned with the 5 core pillars of the government manifesto, the Sustainable Development Goals, the Africa Agenda of 2063, and other regional and international economic development frameworks. Last but not the least, the government is committed to improving the employability and the life skills of our youth by enhancing the quality and the relevance of technical vocational education and training in partnership with industries and private sector. Those accomplishments reflect our commitment to advance the universal sexual and reproductive health, demographic diversity, universal education, gender equality, integration of population issues in policies and plans, and sustainable development. Distinguished guests, ladies and gentlemen, despite the great progress made, there are some challenges that have undermined these efforts. First, the pandemics, which has hampered the trajectory of our social economic growth and also has had impact on our health indicators. The emerging population issues, especially youth unemployment, migration, rapid urbanization, humanitarian crisis, climate change, war and conflicts are some of the issues that are really are reducing our progress. Other issues are insufficient national budget allocation and donors' priority funding for the South-South cooperation in reproductive health, population, and development. Institutionalization of the South-South triangular cooperation as a model for development in achieving ICPD and SDG global agenda, and scarcity of center of excellence on South-South cooperation on population and development in developing countries. In this endeavor, Kenya is trying to establish a center of excellence so that we can create a hub where other countries can learn, especially on issues to do with population and development, in particular, issues to do with population policies and population management. Excellencies, distinguished ladies and gentlemen, looking ahead, the next 5 years of ICPD and beyond, the changing global crisis present as significant opportunities for harnessing the potential of 21st century South-South triangular cooperation by strengthening the critical role of South-South triangular cooperation as a key accelerator in global advocacy, knowledge exchange, technical cooperation, and capacity development towards achieving the ICPD and SDGs. The government of Kenya remains committed to promoting South-South cooperation for acceleration of the achievement of the national, regional, and global goals and commitments on all matters related to population and development and reproductive health, which also aims to transform the country into a industrialized country by offering a high quality of life to all its citizens as envisioned in our Vision 2030. Thank you, and may God bless you.